tuberculosis in, say, Zimbabwe? I ask this because although I'm using Zimbabwe as an example in my question, please reply with reference to Mozambique, Tanzania, Zambia, as well as Zimbabwe, given that besides South Africa, in the SADC region, these 4 countries are lagging behind South Africa by many weeks, and no modeling information is readily available to their populations to even talk about a curve. Moreover, in Zimbabwe, the rapid diagnostic test kits...
Can you please get the question very shortly, please?
Sure. I'm about to finish. In particular, OneFo are currently being sourced, and yesterday there was a flurry of debate about their use in that country and their validity. Thank you.
I'm not sure we understood really the question here.
So the question I'm asking is, number one, can you speak to the lower respiratory infections? Are they ranked second behind HIV and AIDS, ahead of tuberculosis? I was using Zimbabwe as an example, but I'm asking you to speak more specifically for Mozambique, Tanzania, and Zambia, and to speak a little bit about the rapid diagnostic test kits, in particular OneFo, which is being used in Zimbabwe.
So these are many questions, so I don't know if any of our experts can.
What I would suggest, your questions are important, but they're very specific to individual countries in Southern Africa. I do know that for the case of Zambia, Mozambique and Zimbabwe, that the reported numbers from those countries are low, but in Zambia there's been a 50% increase in the last week, though the numbers are low. The number of deaths remain low. And obviously, in that reflecting a reality, that's positive, but it can also reflect underdiagnosis of cases. So what I would suggest is, given the detail of your questions, that we can try to answer them in writing to you and give you the level of detail that you actually need. Because to compare, I don't frankly know the background TB rates in those 4 countries off the top of my head, and certainly for HIV and other things. But we would be delighted to answer your question directly, and if you can send an email to Tarek and the media team, we'll be very happy to engage with you directly, and I'll be happy to do that personally.
Thank you very much, Dr. Ryan. Next question, Kai Kupferschmidt from Science. Kai, please.
Eric, thanks a lot. Thanks for taking my question. I'm just wondering,